I spoke with candidates familiar with the health file from each of the major political parties. Here's how they propose to fix Canada's doctor shortage. The Conservative Party says it's listening to physicians who want a pan-Canadian license so that they can practice anywhere in the country. It's also promising to do more to help internationally trained physicians
and bring in a Blue Seal program to help immigrants take a test, prove they're qualified, and get to work in their field.
The party also wants to speed up the time it takes to get a medical degree, which right now takes at least 10 years.
Increased academic training time is taking away from the care that Canadians need. And the time for planning and talking is over, and the time is now for action, including the deans, and I've said that to them.
Candidate Stephen Ellis, himself a family physician, says it's not about increasing money for health transfers to the provinces and territories. Rather, it's about good federal leadership, something that he believes has been lacking in the Liberal government.
We'll help tackle this shortage by working with the provinces and territories to create more spaces in medical schools like this one.
The Liberal Party is also promising to make it easier for doctors to work in any province. Candidate Kamal Kara, who has worked as a registered nurse, points to a 10-year, $200 billion healthcare deal with the provinces and territories. It was first announced by the Liberals in 2023.
And we made sure that this funding also to the provinces is conditional on results, because Canadians deserve to see progress on this issue. They deserve a family doctor. Everyone deserves to be able to go to their primary care health team and get the care that they need.
As for internationally trained doctors, the Liberals announced $52 million towards the Foreign Credential Recognition Program, which would include people looking for work in healthcare. The NDP is promising a family doctor for every Canadian by the year 2030.
To encourage and incentivize, we're going to offer a 1% increase in healthcare transfer for provinces that sign on to this idea.
In addition, the NDP, like the other parties, is promising to allow pan-Canadian license and to streamline the process for international medical graduates to practice in this country.
We also need more community-based clinics with the team-based care model. We have to expand the scope of practice of medical professionals such as nurse practitioners and pharmacists. That'll take a little bit of the burden off family docs.
The NDP's health platform also includes training more doctors from and for northern and rural communities, reducing the administrative burden for doctors, and hiring 35,000 more nurses by the year 2030. As for the Green Party, it wants to reform the Canada Health Act and introduce the Primary Care Health Act, which would provide accountability measures so that the provinces and territories spend more money on primary care. The Bloc Québécois wants a federal government to pay 35% of the province's healthcare costs. As for national licensure, they're concerned lest Quebec physicians move to other provinces. Do you have more questions about healthcare during this election campaign? Leave them in the comments, and if you want to read more, check out the party's healthcare platforms here.